Welcome to CASA Presents Your Mental Health. I'm Leslie McDonald, and I'm absolutely delighted to be the host and moderator of this brand new COVID-19 webcast series. This is being brought to you by CASA Child, Adolescent, and Family Mental Health. CASA is a very well-respected nonprofit organization providing assessments and treatment services for infants, children, and their families in Alberta for more than 30 years. This webcast is about sharing CASA's insight, resources, and expertise to give you reliable, accurate information during this time of ongoing uncertainty, and for many, a time of stress and anxiety. Our goal is to inspire conversation, hope, and wisdom. We want to give special thanks to Alberta Health for making this series possible. We also want to thank our ongoing partners, Edmonton Public Schools, the Institute for Health Economics, and the University of Alberta Department of Psychiatry. We also want to acknowledge Global Edmonton for their partnership in this monthly series. We're going to be delving into a number of different topics over the next several months, and the format is simple. We're going to bring you insights from a respected expert, followed by a panel discussion. Since this is early September, it is the perfect time to talk about something that everyone is talking about, and that is returning to school in a pandemic. And our special guest today is Senator Dr. Stan Kutcher. Senator Kutcher was appointed to the Senate of Canada in December 2018. He brings to the position a distinguished career as an internationally renowned psychiatrist in adolescent mental health. Before becoming a senator, the Honourable Dr. Kutcher was the department head of psychiatry at Dalhousie University in Halifax, where, among other things, he led the development of a national child, youth, and youth mental health framework for Canada. He's also been involved in mental health work in over 25 countries. Dr. Kutcher has been recognized with several awards and honors, including the Order of Nova Scotia. As a senator, he continues to advocate for youth, health, and mental health nationally and globally. He joins us now from Halifax. Thank you so much for speaking with us today, Dr. Kutcher.
Well, thank you, Leslie. Thanks for having me. And thank you to you and CASA for taking this wonderful initiative and putting on what sounds like it's going to be a great series for people to tune in.
Well, you know, these are interesting times that we live in. I mean, we're going back to school in a way that we've never gone back before. And I think with all of this uncertainty, it's causing a lot of anxiety. People are quite stressed about it.
Well, yes, and they should be. And so one of the most important things to do when we talk about going back to school is to label the emotional response that we're having for what it is, which is fear. People are afraid. There is a threat, and fear is the hyperarousal state that we get into when we face a threat. This threat is unprecedented in modern Canadian history. And we are learning how to mitigate the threat. The hyperarousal will go down when we have successfully mitigated the threat, but at this point in time, we're dealing with a lot of uncertainty. And many people have concerns, legitimate concerns. Public health officials are doing the best they can with the data that they have. And we expect new data will be coming in as we start to move, and which will necessitate possible changes, pivots in how we're approaching these things. All in all, this is a challenging time for sure.
So what does that look like for people? Fear?
Well, it can be many different things. One thing that's important to remember is that fear is contagious. And that if we continually just move with our emotional responses instead of bringing in the cognitive components, we can actually have detrimental outcomes, because when we're driven only by our emotional response, that can sometimes take us to places that we don't necessarily, in retrospect, want to have been. So I think it's really important, a couple of things. One is for parents to realize, and for educators and for all of us to realize, that we have to control what we can control And secondly, to keep these threats and these concerns in perspective and to try to work together to optimize good outcomes for everybody.
So one of the first things that you said to me when we spoke is you kind of got to step back and you got to take a deep breath and sort of start at the beginning, get some perspective on what's going on.
Oh, absolutely. You know, stay calm and carry on. That phrase came out of the Blitz in London at a very, very stressful time when death rained from the skies, and you could be walking down the street and you wouldn't be there anymore. So this has a tremendous wisdom for us. I think it's really important to realize that the feelings that we're getting are normal. They're not a sign of pathology. They're not a mental illness or mental disorder. They're normal feelings, and that their purpose, they have a purpose, and their purpose is to focus our attention on the problem or challenge at hand so that we can start to figure out, using our cognitive capacities and our collaborations with each other, we can figure out how to best mitigate the challenge that we're facing. And so it's really important that we, while we stay calm and carry on, that we don't forget that this emotional response has a purpose, and that purpose is to help us solve the problem. So utilizing that energy for problem solving instead of utilizing that energy for avoidance is really, really where we need to go.
You know, that brings something up. I talked about in the intro that you have worked around the world in 25 different countries. And one of those has been where you have been in very high stress situations after natural disasters in war-torn countries. What did you see there, and how would it apply to what people are going through now?
Well, yeah, thanks for raising that. Some of the natural disasters, really major challenges. Some of the war zones, unmentionable atrocities and difficulties there. Two things always struck me. One was the natural resilience that people have, and that given safety, shelter, and security, people will rise to the challenge. They have historically risen to the challenge. And that doesn't mean that there won't be difficulties or problems along the way. And it doesn't mean that we won't have negative emotions as we deal with these things, but it does mean that we have the capacity, not just by ourselves, but in collaboration with others, to solve the problems that we are facing. So never underestimate the capacity for resilience, and encourage all those things that human beings have done for centuries that have made them resilient. And then the second thing is the importance of changing our cognitive mindset to deal with this issue of uncertainty. Now, human beings like certainty. We like to have, we like to be told everything's fine and here is the reason for everything. In fact, I think that that's one of the reasons why we see so many conspiracy theories around this day, because conspiracy theories in an interesting way provide some certainty. They explain the world. Always all because of so, or it's all because of such and such. And we like certainty, but in times of uncertainty, it actually also gives us a tremendous opportunity to think outside the box. It gives us a tremendous opportunity to reset what we are doing. It gives us an opportunity not to make the same mistakes we have been making before, but to look at different ways of doing things, because this is a different world. COVID has changed our world. And so it has given us an opportunity to also change our world. So I think that if we can reframe some of the challenges we're having as challenges which will in the long term be better for us, I think that helps us deal with the uncertainties that we are facing in the short term, for sure.
Something too to keep in mind is the fact that over time that uncertainty is going to become less and less, that things will start to show themselves that maybe we can't see right now.
Well, you're absolutely correct. And the trouble with uncertainty is that it's uncertain. And one of my favorite philosophers, Yogi Berra, who is the catcher for the New York Yankees, said, predictions wouldn't be so hard if they weren't about the future. And I think we have to keep that in mind. The virus could change, could mutate and vanish. We could get a vaccine that works really, really, really well. We could develop really effective treatment. We don't know any of these things. Or it could persist longer than we think it would. It could persist. The WHO is saying, think about it as a 2 to 3 year phenomenon. We don't know. But the thing here is that when you're sailing in uncharted waters, to use a nautical term from Halifax, it gives you a chance to explore those waters and to maybe think about what you're doing in a slightly different way. And opening up schools and going into the new educational paradigm doesn't necessarily mean we have to do things the same way we did them in the past. I didn't hear a lot of people telling me last year that our education system is so wonderful, every kid is perfectly served, we should continue with this perfect education system we have the way we've always had it. I never heard that because it wasn't. So I think that if we look at this reality of change that COVID is bringing us as an opportunity to actually make changes that we maybe should have made before, I think that gives us a very different framework. It gives us a challenge. It gives us a purpose instead of just telling us that we're afraid.
You know, the interesting thing as well about this time is that, we've thought of mental health as something that a certain segment of the population, I guess, deals with. But it's become something that's on a much broader perspective now. And you have done student-based mental health initiatives. I think you called them literacy. You called it literacy, student mental health literacy. What have you learned from that with the work you've done that could be applied here?
Thanks for raising that. Many things. One of the challenging things is we learned how illiterate we are as a population about mental health and mental illness, about how we confuse, how even our language is confusing, how we confuse a mental disorder with normative existential reactions to what life brings us, which is part of the phenomenon of being a human being. We have learned that many people just don't understand the stress response. And the word stress has a huge negative connotation when actually the experience of the arousal reflex is really, in most cases, a sign that we need to actually take on a challenge or opportunity. So we've learned all sorts of these things. And when young people and their teachers understand these concepts, they are able to take better control over themselves. They are better able to self-regulate. They are better able to use the exigencies and existential challenges of everyday life to actually become more resilient, to take that energy and understanding and move it into resilience so that they can understand how to adapt themselves to the challenges that they face. It's so important that the mental health is not about feeling good all the time. And that's such a common misperception that if I feel good, that I have good mental health. That's not the case at all. If you have appropriate emotional responses to what life is bringing you, and you are using those appropriate responses to better adapt to what life is giving you, that's mental health.
Wow. You know, I think on that note, it's a really good time to bring in our panelist, one of our two panelists next to join the conversation. Karl Merritt is a registered psychologist who oversees CASA's specialized day treatment programs. These are small mental health classrooms from pre-kindergarten to high school. Karl has worked as a school social worker and a therapist treating children, adolescents, and their families. And he brings knowledge and experience of both school and mental health worlds to this conversation. I'm so glad that you're here, Karl, because that is what Stan was talking about, really brings up a good point. It seems that people who have been there are certain people who've been dealing with mental health issues who've been using strategies that we can really learn from during this pandemic.
Yeah, absolutely. And just to build on what Dr. Kutcher said, absolutely, I think we need to acknowledge, there is fear, there is uncertainty. That's a reality. That's not just in people's heads. It's in our heads and it's in the world. And generally, that's a good thing when it's both places. And I also, all feelings are okay. In fact, we want people to experience. If there's something to be afraid of, you should feel afraid. If there's something sad, you should feel sad. If there's something excitable, you should be happy. We want people to express and experience a variety, all the emotions, but we also want to be able to regulate them and to think about our thinking too. So I really appreciate Dr. Kutcher's comments on, let's feel the feelings, acknowledge them, take a breath, and see this as an opportunity to guide problem solving.
I think most people aren't aware that a place like CASA actually has classrooms. So can you tell us a bit about how that works? That's actually based on Alberta curriculum.
Yeah, so at CASA, we offer a variety of different levels of care, as we like to say. From you just see us, as on a drop-in basis or in a clinic, to you actually come to school at CASA for 30 hours a week for 5 months. Or for in our pre-kindergarten, kindergarten program, you come for 2 days a week for the whole school year, 10 months. So we've run schools in partnership with Edmonton Public for about 20 years at CASA.
We talk about the risks of going to school during a pandemic, because you start school this week as well. But also the risks of not going to school. Tell us about that.
Well, I think that's important, particularly talking about one thing we know about fear response is that actually we really attend to what's dangerous, which from evolution perspective is really good at keeping us alive. If I'm a cave person and I forget where the tiger lives, that's a big problem. I wouldn't be around, or my ancestors that thought that, I wouldn't be around then. If I forget where the rose bush lives, I live another day. So yes, there's absolutely risks in the context of COVID, but we also know that there's substantial benefits to going to school. And sometimes we're not wired that way. We need to remind ourselves, why do we send kids to school in person? What is the value of education? And how do we kind of balance benefits with risk and make sure we think about both? Analogy I use for that is driving. I drove here to the studio today. That's probably actually the riskiest thing I do in my day-to-day life. But why do I do it? Well, I like, coming here. I like going places. Now with COVID, obviously I've gone a lot less more, and flying has been out of the picture, which is part of balancing risk. But how do we manage the risk of driving? Well, I also passed a police car on the way here. I went through lots of traffic signs. I have my driver's license. I did training, right? If I'm driving with someone else, they give me guidance too. Do I like to know where I'm going and as I navigate? Absolutely. So I use GPS, not on my phone, because that also is part of how we manage risk. Sometimes you don't know where you're going, and that's a lot harder.
So what do you think the risk is of not sending kids to school?
Yeah, so what are the risks? And I also think it's, I want to be clear that, just having a kid in the classroom doesn't mean they're learning. Which is important. Now, not having them in class doesn't mean they're learning either. To me, I don't know what are the risks. What are the benefits of school, and to think about that? Because to me, yes, there's risks of doing anything during COVID, but it's not the only risk, right? There's why do we go to school at all, as I asked earlier. And there's also substantial benefits to many other things. So example of risk perception is I heard that, there's been a lot of literature about, people who haven't been attending the emergency rooms in the context of heart attacks because they don't want to track COVID. So we need to, yes, feel the feelings, but also use our head.
So all along during this pandemic, you've been using technology to talk to your patients, to do classrooms. What have you learned from that? What can you pass on for parents and teachers that might help them as they move into a bit of this uncertain territory?
Yeah, and I think that what will be the lessons learned as we're still learning them is kind of a hard question to answer. Certainly, as my work as a psychologist, have always done some level of virtual sessions, if you will, typically over the phone. Now more things like Zoom and other secure platforms. For some, we're more blending. So as mental health being an essential service at the level of care I work with, there's been some things where I've had to have patients in or clients and families in. When they come in, we try to as much, we're looking at things to mitigate risks, just like schools in terms of physical distancing, good hand hygiene, screening, masking. We've all heard those messages. Certainly do that. The other thing is sometimes if they're not needing to come in, that, we've had them on video. One of the programs that I'm the manager for, we run a parenting group. Interesting, we delivered it via WebEx, and it actually had the best attendance ever because I think it saves people some driving and childcare issues.
Wow, isn't that fantastic?
Yeah.
I want to talk a bit further about those different aspects, but I want to bring our next panelist in. Jacquie Pei is a professor in the Department of Educational Psychology at the University of Alberta, and she's an assistant clinical professor in the Department of Pediatrics. She's also a practicing registered psychologist and a researcher with a focus on collaborative, community-oriented approaches to supporting healthy outcomes for children and youth. So I want to welcome Dr. Pei. You have a very interesting background. You've worked as a criminologist and a forensic counselor working with incarcerated youth. You must have learned an awful lot that applies now.
Absolutely. I sure have. And, just as the speakers before me, listening to Karl and Dr. Kutcher speak, about some of the resiliency and opportunity that they see in kids and in folks in general. When I think back to those days in forensic settings, that I think is one of the biggest experiences or outcomes in terms of how I learned to think about what's possible, is that even in the most difficult times, in the most complicated of contexts, success is possible, resiliency can emerge, and remarkable things can happen. I think Dr. Kutcher talked about opportunities. I was actually sitting here cheering as he was talking, because I really was, because I love his comments about how even adversity, and back in those forensic days, that adversity was very real for those kids that I worked with. But it created opportunity for change, opportunity to move forward in a different way that wouldn't have been possible for them without that adversity that they were experiencing. So I find that a really exciting way of thinking about things, and to use his words again, to reframe our perspective and our approach to going forward when we work with anyone.
Now, you have a very broad community-based practice. You apply a number of different principles, and it's a specialty practice as well, along with research. Can you tell us a bit about that and what you've learned from it?
I think I've learned, and both my practice and my research have really begun to align. And you've heard a bit in our conversations today about the principles of resiliency. And that's something that has become really prominent in both my clinical practice and my research work, in which we work towards, and actually I'm going to come back, and I feel like I'm just sort of reiterating Dr. Kutcher here, because, when you hear those, that kind of comments he made, they're so resonant. And when you're working in collaboration, when you work with people, it's remarkable what you can discover in terms of what generates or contributes to healthy outcomes for people. And so in my clinical practice, I have the opportunity to work with a number of folks who have experienced all different kinds of adversity. And in that adversity, working together, we can begin to identify the strengths that they possess and the way forward, the way they can leverage and capitalize on their strengths, and that they don't need to be defined by their adversity alone. Rather, they can be defined by their strengths and who they really are. And in my research that kind of accompanies some of the work I do in my practice, we found that those healthy outcomes are most attainable by those individuals that begin to feel some control over some aspect of their lives that's situated in a positive sense of themselves. I am capable, I can have an impact, I can't change it all. I can't erase the pandemic, but I can think about how I respond to it in a way that might support a healthy outcome for me, for my family, for my child.
You know, there's another element to that too, and that is, where you focus, your belief is a huge part of resiliency as well.
Absolutely. How we think about or situate a challenge really has an impact on how we generate a response to that. So although, as we've heard today, fear is very real, and talking about and experiencing our emotions right now is really important. And we have to be comfortable being authentically who we are in that moment. But we can also choose to reframe the way we're thinking about things, not just to be about fear, but to be about opportunity. And when we shift that perspective a little bit, and we start to look at, well, what could this do for us? How could we have fun with this? I mean, we're talking about a pandemic, and I just said have fun with it. That sounds really contradictory, but it doesn't have to be. When we're working with our kids, when we're talking to our kids about how to make sense of this, how to go through their days, it doesn't have to be entirely about their fear. We can reframe it and talk about their opportunity. We can talk about their masks as being part of their superhero costumes. We can help them start to identify their superpowers and the way that they're going to be able to uniquely influence their day, their peer interactions, their school experiences, because of the strengths and the capacities that they bring. We can refocus our kids, acknowledging their fear. It's real fear, but also allowing them to focus on what it means to regulate, what it means to be healthy, and what it means to capitalize on their areas of strength.
And that's something that you really focus on in your practice, is capitalizing on children's strengths, building on that. So what does that look like?
Wow, that can look like a lot of different things. Our kids all have different strengths. Dr. Kutcher, and I think actually both Karl and Dr. Kutcher talked about regulating and how our kids might regulate. And regulation means getting some control over our emotions or managing those feelings of fear. And those are things that we can do knowing what their children's strengths look like. If our children have strengths in music, for instance, if music is something they like to do, they enjoy doing, they have fun doing, then learning to regulate in their music. To think about, oh, I'm going to use these songs when I'm washing my hands. I know a lot of parents out there might use the ABCs as they wash hands with their kids. This can then become something that is more fun and which engages them in something that they feel empowered by, as opposed to something I've got to do. How they engage with their peers can be, again, building on their strengths. You're really good at helping the people feel good. Let's work on that. Let's play with that. You can still do that in a pandemic. In fact, it's even more important now. So we essentially identify for our kids or support our kids in self-identifying those things that they can leverage as they go forward and say, how do I make sense of school now? How do I engage with people?
Wow. Okay, I'm going to open this up to a broader discussion. And I'm going to ask a really big question, so I'll apologize for that in advance. What does good mental health look like? Who wants to begin on that? Stan?
I'll take a kick at that, Ken. It means being alive. It means taking on the challenges and opportunities that life gives you. It means feeling horrible pain at times. If someone you love dies and you don't feel horrible pain, you have a problem. It's situation appropriate emotional, behavioral, and cognitive responses. That's what mental health is. It's not about feeling good. And I think we have done a lot of kids a disservice and a lot of adults a disservice by intimating that they're supposed to feel good all the time. And then when that's not real, people feel bad that they don't feel good all the time. I mean, it's such a common refrain that we hear over and over and over again. Mental health is the willingness and the capacity to engage with what life gives you. And sometimes life gives you things that are good, and sometimes life gives you things that are crap. But it's that capacity to roll with the punches. As Churchill said, when you're going through hell, keep going. That's part of it. And when you're in a good time, reflect that it is a good time and feel gratitude and joy that you have that good time. And remember that other people deserve a good time too. And what can you actually do to make your world better? I mean, those are all parts of having good mental health. That's how I see it anyway.
Well, you know, one of the things that I've heard over and over again from people is this: I'm really, enjoying the time away. Things are really good with me during this pandemic, but I'm scared to say anything. I don't want to, insult anyone, or I don't tell anyone. I've heard that over and over and over again. And Jackie, I can see you nodding your head. And I guess I'm thinking, well, how can we use that to show people how to cope better with what's going on? And I recognize we all have different circumstances, but there has to be something we can learn from that.
I agree. I think it's interesting. And I think it's actually kind of like we were just talking about people always needing to feel good. I feel as though there are aspects of mental health that we've decided have to be weighed and measured against other people's experience. And we have to always be good. We always have to live up to something, some standard, or live down to a standard, and that this authentic experience of emotion and taking emotional risks and working through emotional good times and difficult times has to all be sort of almost normalized or equalized. And in fact, it's not, and it's not at all.
The message is there about, you talked about your son Stan, right? When you were out driving with your son, not Stan, your son Nathan. I know.
That's really interesting.
And that, sorry, where you look, that's where you go. Can you tell us that story? Because that really gives that perspective as well.
I sure can. He may never forgive me for telling this story, but he's a good boy. And this is back to a conversation we were having about how what we focus on, what we think about, is the direction that we go in. And in this case, we were out riding a bike, and Nathan was maybe 3 or 4 years old at the time and was just getting good at being on a 2-wheel bike. And so we were out riding on the roads. And as we rode along, there were a number of parked cars along the side of the road. And being the worried mother that I was, I yell out to Nathan, "Nathan, don't run into the parked car," because of course that was where my fear was. What did Nathan immediately do? Ran into the parked car. Yes, you laugh, but it's true. It's totally true. But when I reflect on that, it reminds me that we go in the direction we look in. So if I just point out the risks, if I just say this is the direction, this is where you could go, that's what he sees, that's where he goes. If instead I had said, "Nathan, look at the road, follow the road, go ahead," he would have been better able to navigate. He may have still hit some potholes and jarred himself around, and some of those emotional risks that Dr. Kutcher talks about would have still been there, but maybe he would have made it along that road. And so it's kind of been a reminder for me ever since. And there's lots of good research evidence that tells us that what we expect often has a huge contribution to where we end up. If I expect to fail, I'll probably fail. If I expect to succeed, then although the path to success may be complicated, difficult, and even bumpy, I'm going to make better progress towards that success because of that expectation. Same goes for those around us. So parents out there, if we expect our kids to run into difficulty, if we protect them so much that they'll never have any challenge, we're kind of messaging to them, you can't handle challenge, you can't do challenge. If instead we say, you know what, I'm going to let you fall down, I'm going to let poor Nathan skin his knee a little bit, he's going to learn that he can get back on the bike. He's going to learn that he can keep going. And so even as our children go back to school this fall and we're afraid, we also have to model for them and demonstrate that we have confidence in their resiliency, and we have confidence in their ability to manage the stress and to come out for it even better and better able to manage in the future. They're in some ways getting an opportunity to learn how to cope and navigate in a world that will help them to be better citizens in the same world in the future. They're going to think about each other with different kinds of compassion. And then when they're asked, are you ashamed of the fact that you feel good about your experience in COVID because you connected to people? Maybe they'll have the confidence to say emotionally, authentically, no, I had a good experience. I'm doing okay.
Karl, how are you preparing your students? You've got high need students coming to your school. How are you helping them to prepare?
Yeah, so part of that is providing accurate information, and this summer has been my busiest summer actually.
Yeah.
So one, just reading the reams of regulations and rules, which is important. But by making sure that we're meeting ahead of time with every child and family to answer their questions. But just to pick on, I'm always a fan favorite of sayings. One of my favorite is monkey see, monkey do. And I think for caregivers, for parents, teachers, to be very aware of our own fear or maybe even anxiety about this, even when the presence of the feared stimulus isn't there, is really important. For example, my private practice, I've seen probably 5 kids, I'm just thinking in my head, here where the parents like, oh, my poor kid, I'm slightly exaggerating for comic offense, my poor kid, he's so scared of catching COVID. And the kid's angry that he can't have his hockey team. That is an appropriate thing. He likes hockey. COVID killed his hockey. I called COVID a dementor. Yeah. It sucks all the fun and joy. So I think we'd be really careful as a society, how are we framing this? It's not the only risk. Otherwise it will be a dementor that sucks our soul out if we let it get too close to us, which is good for the physical distancing folks if you want, but which is important, but absolutely. So to me, as it's being very aware of ourselves, and I work for a principal, and she asked me once, this was prior to my coffee, are you surviving or thriving? And I'm like, go away, I need my coffee. But before that, it's actually part of that reframing.
Yes.
There is opportunities, and are we just surviving or are we thriving? I also think be very careful to not pathologize something that just makes us human.
Yeah.
You don't get your hockey game, you're angry, that's good judgment. That kid is not coming to me because of a mental health problem. I'm, using my wand of expertise to not give them a diagnosis. Now, that's not to say that we don't need prevention from this creating mental health or mental illness. So one of the challenges for here, I would say, I'm kind of dodging your question if you want, but is, I've never in my career tell someone, just stay at home, don't exercise, sleep whatever is convenient for you. If you're afraid of something, just stay in and do that. No. Most of my career is, I call it exposure. Anxiety, number one strategy. What do we know about people doing well? Face your fears. Now, we need to be sensible, but face your fears. Stretch your comfort zone. I like the term legitimate suffering. Is an old term from the 70s, which to me is old, for other people maybe not. But there's some work we need to do to get well or to stay well. We need to stretch our comfort zones, and that requires thinking about our thinking. The other thing is, one, to prevent, becoming down spirit, to become clinically depressed, is the number one strategy is what we call behavioral activation, which is just a fancy way of saying, make sure you schedule, make an effort to do fun things, right? If you're severely depressed, maybe having a shower. If you're, kind of just a bit more down, and there's continuum for these things, make sure you schedule that bike ride, right? And the other thing is for people who, mom says, don't go hit the car, and they hit the car, that kind of oppositionalism. No, I don't think that was that. Is, we need to increase structure, organizing, predictability, which is one of the big benefits of schools. Is no one can run their home like a school, is my view.
Okay, so one of the things that's going to bring all of the things that we've been talking about to the fore, it's not a matter of if we have another wave with this pandemic, but it's a matter of when. And the biggest fear, and it's a real fear, when we're sending kids back to school, of another outbreak and what that outbreak looks like. And again, it's the unknown. We don't know what's going to happen. But with this wonderful panel, with all these fantastic insights from this incredible experience that you all have, how can you add to that? How can you help people as they know moving forward about what could happen and likely will happen?
Well, look, it's always better to be over-prepared and underwhelmed than under-prepared and overwhelmed. I mean, that's a lot. We've known that for a long time. We also know that how we prepare will change given the data and evidence that comes in. So right now, face masks, okay, because we know the droplets and aerosols are, viruses transmitted to those. Before it was fomites, what you touched. Yet I'll tell you something, I see schools spending an incredible amount of time and energy cleaning every damn surface, and some places don't have kids wear masks. So, I mean, come on, let's get it. There is data that we can use. Let's make sure that we use it. But I just want to add one thing that is so important, and both Karl and Jacquie touched on it, is that there is power in knowledge and an ability to control these contagious emotions. And one thing that I've not heard anybody talk about, but we got to start talking about it, is when the kids get into the school, they are going to be exposed to a whole whack of misinformation about COVID. And it's really, really important for both schools and parents to ensure that they provide reasonable, scientifically based information about COVID, what it is and what it is not. And they're going to be exposed to a ton of misinformation about vaccines. And because these components are now very prevalent in our social discourse, they're all over social media, they're in the regular media. And I think that one thing that parents and schools really need to start thinking about is how are they going to ensure that when kids come to schools, they're going to get solid knowledge and not misinformation. How are they going to counter that?
Wow, great point. I can see you nodding, Jacquie.
Yeah, I completely agree. I think it's a nice, again, back to the word opportunity for schools, parents to work together to think about what that clear communication is, but to also work with our children to really equip them to be critical consumers of the information they're provided. And I think that's something we've talked about over the years as our kids are increasingly exposed to high information loads through the internet that we have really a hard time regulating, controlling, no matter how hard we try. And so I think explicitly talking to our kids, how do you know when it's a good source? What does that mean? Where do we have these conversations? Who are the people I should fact check with? Having conversations with your children to prepare them to be critical consumers, to support them in building those skills around how to consume information in ways that is healthy and helpful to them is going to be really vital and is going to be another skill set that then we're going to be helping our children develop, which is only going to serve them more positively into the future.
Okay. Karl, what are your final thoughts on this discussion? Something that maybe we haven't.
And discussion is a good word because I think, there's multiple conversations that, this is ongoing. Mm-hmm. And I think, know what do we know? What don't we know? And kind of what do we want to know is kind of a teacher's trick of you doing. But I like the concept of literacy, whether it's just literacy of health or of mental health, right? So, and I also think for people to, balance, feelings with thinking, to take a breath, to acknowledge, and it's okay not to know something and to resist the urge to, get out our crystal balls and make kind of pronouncements or take an easy way in terms of blame or a conspiracy theory. Probably more, I like to think more blaming than conspiracy theories, but they're both true. So to me, I guess my final thing is, for anything we do in life, there's benefits and there's risks. So in some ways, the question about parents as they're thinking about their child going to school is to, be clear in their own head about that. And then you make a decision, are you sending your kid to school or not? Well, for a lot of parents, that's actually not a choice. So I put choice in quotes. I'm also mindful of my final thought is, we don't want to be as a society, there's a story about a donkey that is between two piles of hay that are both the same size and same distance. And, the donkey ends up starving between the two of them. We used to talk about the approach avoidance conflict, or this is a double approach. As I think about, going to school, what are all the risks there? Maybe I won't send them to school. Well, look, then my kid won't get this. And we go back and forth and back and forth. So I think to acknowledge that there's strong emotions about this, that's part of the dynamics of the decision making, to take a breath and make a decision, and we kind of live with it, but we're open to refining, revising as families and as a province and as a country.
Thank you for bringing that up, because that's something that I'm certainly seeing with a lot of parents is real indecisiveness about what to do and confusion. Dr. Pei, final words you'd like to say?
I just think this is a great conversation. I think that the more we can really be conscious about how we frame and make sense of this with our kids, it's going to be important. Have a plan. Have some ideas as how you want to go forward, how you want to identify and leverage your child's strengths. And I guess also a final note is that it's not a one size fits all. So you and your family are going to be unique. You and your children have your own specific dynamics. So don't be concerned if what your neighbor is doing and your friends are doing are different than what you're doing. You know your child, you know your family. Have confidence in your ability as well to support your child, create safety for your child, structure for your child where you can, and to help this to be a learning and a growth opportunity for them, not just something that they're afraid of and that's going to be a barrier, but rather a door to opportunity and success in their future.
Thank you for that. Dr. Kutcher, I'd like to give final word to you.
Well, I don't have too much to say that hasn't been already said by Karl and Jackie, but I just want to focus a little bit on these incredible opportunities that COVID has created to reset our society. It has shown us that the most vulnerable people are hurt the most. And we can't keep ignoring that. We've been very good at ignoring that for quite a time. Mm-hmm. It's shown us that close interpersonal relationships are the key to improving our lives. And that the connection that we have with each other is the key to improving the human condition. And I'm hearing over and over again families saying that, gosh, I've never spent so much time with my kids. And at times it's a real pain in the ass, but at times it's been wonderful. Yeah. You know, maybe it's going to give us a slightly different perspective. Maybe it's going to challenge our wish for, you know, superfluous abundance and overflowing materialism. And it's going to let us step back from that and say, what are the important things in our lives? And how can we now, with this new challenge that has been thrust upon us, not only see this as a challenge, but as an opportunity?
Oh, thank you so much for that final word. Dr. Kutcher, your interview with the Global Morning Show is going to be coming up today, and that'll be available on globalnews.ca. So look forward to seeing that. Thank you so much to our panel and those fantastic insights. Really loved having you here. We'll have you back again for another one of these wonderful monthly sessions. We continue this web series next month with more on going to school in a pandemic. We're going to have a chance to have a month behind us at that point. Our guest is going to be Alberta Health Services Senior Medical Officer of Health, Dr. Laura McDougall. And I mentioned earlier that CASA is a not-for-profit organization, and your support for their work with families, children, youth, and infants is very much appreciated. So we encourage you, please text CASA to 393939 for information on how to donate. On behalf of CASA, thank you so much for joining us. I'm Leslie McDonald. Be well, be kind. See you again soon.
Thank you, everybody.
Thank you.